Number 1. Common cold. It's something every parent is familiar with. Kids can get a cold up to 10 times a year, especially during the winter months when they're more susceptible to viruses. Most colds are mild and will clear up on their own within a week or two. However, it can be tough to see your child feeling unwell. Rest is key, so make sure your little one gets plenty of sleep. A well-rested body can fight off infections more effectively. Keep them hydrated with plenty of fluids like water and clear broth. Hydration helps to thin mucus and keeps the throat moist. Ease their symptoms with over-the-counter medications like saline drops for a stuffy nose or acetaminophen for fever or aches. Always follow the dosage instructions. Prevention is always better than cure. Teach your kids good hand hygiene. This simple habit can significantly reduce the spread of germs. Show them how to wash their hands properly with soap and water for at least 20 seconds. Make it fun by singing a song while they wash. If there's no soap and water available, hand sanitizer is a good backup. Ensure it contains at least 60% alcohol for effectiveness. Disinfect frequently touched surfaces in your home like doorknobs, toys, and remote controls. Regular cleaning can help keep the virus at bay. Another helpful tip is to keep your child home from school or daycare when they're sick to prevent spreading the cold to others. Encourage them to cover their mouth and nose with the tissue of their elbow when coughing or sneezing. Finally, maintaining a healthy diet with plenty of fruits and vegetables can support their immune system, making them less susceptible to colds in the first place. Number 2. Flu. This is not just another cold. It's a more serious viral infection that can have significant health impacts. Unlike the common cold, the flu can be a serious illness, especially for young children, older adults, and people with weakened immune systems. It can lead to complications like pneumonia, bronchitis, and even hospitalization. The flu shares some symptoms with the common cold, like a runny nose, sore throat, and cough. However, these symptoms are often more intense and can make your child feel much worse. It also tends to come on more suddenly and cause more severe symptoms, such as a high fever, muscle aches, headaches, and fatigue. These symptoms can be debilitating and last for several days, making it hard for your child to carry on with their daily activities. Keep your child home from school or daycare to prevent the spread of the virus. This not only helps your child recover, but also protects other children and staff from getting sick. Rest and fluids are essential. You can also give them over-the-counter medications to help relieve their symptoms. Make sure they stay hydrated and get plenty of sleep to support their immune system. Talk to your doctor before giving any medication to a child, especially if they have any underlying health conditions. Your doctor can provide guidance on the best treatment options and ensure that the medications are safe for your child. The best way to protect your child from the flu is to get them vaccinated every year. Vaccination can significantly reduce the risk of severe illness and complications, making it a crucial step in flu prevention. In addition to vaccination, encourage good hygiene practices like frequent hand washing and covering coughs and sneezes with a tissue or elbow. Clean and disinfect commonly touched surfaces regularly to reduce the risk of spreading the flu virus. Number 3. Ear infections. A common issue that many parents face with their young children. Ear infections are very common in young children, especially those under the age of 3. These infections can cause a lot of discomfort and distress for both the child and the parents. They happen when fluid builds up behind the eardrum, and this fluid can become infected by bacteria or viruses. This buildup can cause significant pain and pressure in the ear. Children have shorter, narrower eustachian tubes than adults, making it easier for them to become blocked. This anatomical difference is one of the main reasons why ear infections are more prevalent in young children. Some common symptoms include ear pain, fever, irritability, drainage from the ear, and even hearing loss. These symptoms can vary in intensity, but they often make the child very uncomfortable. If you suspect your child has an ear infection, it's important to take them to the doctor. Early diagnosis and treatment can help prevent complications and provide relief. The doctor will examine their ears using an otoscope, which is a special instrument that allows them to see inside the ear canal. This examination helps the doctor determine the severity of the infection. Treatment may include antibiotics if the infection is bacterial. In some cases, the doctor might recommend waiting to see if the infection clears up on its own. Pain relief can be managed with over-the-counter medications. These medications can help reduce fever and alleviate pain, making your child more comfortable. Keeping your child's ears dry and clean can help prevent future infections. Simple measures like using earplugs while swimming and gently cleaning the ears can make a big difference. Avoiding exposure to secondhand smoke and practicing good hand hygiene can also reduce the risk of ear infections. Number 4. Chickenpox. Did you know that chickenpox used to be a common rite of passage? Thanks to vaccines, that's no longer the case, caused by the varicella zoster virus. Chickenpox is a highly contagious viral infection that results in an itchy, blistery rash all over the body. Vaccination has significantly reduced its prevalence, but before the chickenpox vaccine became widely available, it was a common childhood illness. The chickenpox vaccine is very effective at preventing the disease. The most distinctive symptoms is the rash, which starts as small red bumps that develop into itchy blisters. Other symptoms of chickenpox can include fever, headache, fatigue, and loss of appetite. Thankfully, cases of chickenpox have decreased dramatically, but if your child gets chickenpox, keep them comfortable with oatmeal baths and antihistamines, and keep them home from school or daycare to prevent the spread of the virus. There's no cure for chickenpox, but there are things you can do to relieve the symptoms. Calamine lotion and cool compresses can help soothe the itching, and keeping your child's nails trimmed short can prevent them from scratching and causing secondary infections. Ensure they stay hydrated and get plenty of rest to help their body fight off the virus. Number 5. RSV. Respiratory Syncytial virus, or RSV, causes cold-like symptoms but can lead to severe respiratory issues in infants and young children, which makes it a cause for concern. RSV is a very common respiratory virus that infects the lungs and breathing passages. Most children will have had an RSV infection by the time they're 2 years old. For most healthy children, RSV causes mild symptoms, such as a runny nose, cough, and fever. However, in some cases, RSV can cause more serious illnesses, such as bronchitis, pneumonia, and ear infections. Infants, especially premature babies and those with underlying health conditions, are at higher risk of developing serious complications from RSV. Watch for signs of breathing difficulties, and seek medical attention if necessary. Did you know that RSV is the most common cause of bronchitis in children under 1 year? Keeping hands clean and avoiding sick contacts helps you prevent it. Ensuring that your child's environment is smoke-free can also reduce the risk of severe RSV infections. Supportive care at home includes keeping your child well hydrated and using a humidifier to ease breathing. Number 6. Conjunctivitis. Conjunctivitis, or pink eye, causes redness and discharge in the eyes. It is an inflammation or infection of the conjunctiva, which is the transparent membrane that lines the inside of your eyelids and covers the white part of your eyeball. It can be caused by viruses, bacteria, or allergies. The most common symptoms of pink eye are redness, itching, tearing, and a gritty feeling in the eye. Viral conjunctivitis is highly contagious and can spread easily through contact with infected eye secretions. Proper hygiene and prescribed eye drops are key to treatment. So, teach kids good hygiene practices, such as not touching their eyes, washing their hands frequently, and not sharing towels or eye drops. Bacterial conjunctivitis is also contagious, but usually less so than viral conjunctivitis. It's typically treated with antibiotic eye drops or ointments. Allergic conjunctivitis is not contagious and is triggered by allergens like pollen, dust mites, or pet dander. Identifying and avoiding these allergens can help manage the condition. For comfort, cool compresses and antihistamine eye drops can be used to relieve symptoms of allergic conjunctivitis. Number 7. Hand, foot, and mouth disease. A common viral infection that usually affects infants and children younger than 5 years old. It's characterized by sores in the mouth and a rash on the hands and feet. The virus spreads through contact with an infected person's saliva, nasal secretions, or stool. The illness is usually mild, and most children recover within 7 to 10 days without any complications. The first sign is often a fever, followed by a sore throat, reduced appetite, and a general feeling of being unwell. Painful sores may develop in the mouth, making it difficult to eat and drink. A rash may also appear on the palms of the hands, soles, and the feet, and sometimes on the buttocks. The rash consists of small red spots that may turn into blisters. Keeping your child hydrated is crucial, as dehydration can occur if they avoid drinking due to mouth pain. Offer plenty of cool fluids and soft foods to help ease their discomfort. Remember, good hygiene practices like frequent hand washing can help prevent the spread of this infection. Disinfecting toys and surfaces that your child frequently touches can also reduce the risk of transmission. Number 8. Croup. A common respiratory illness in young children. Croup is caused by a viral infection that leads to swelling of the airways, resulting in a distinctive barking cough. It often starts with symptoms similar to a cold, such as a runny nose and fever. As the illness progresses, the swelling in the voice box, windpipe, and bronchial tubes cause the characteristic cough and sometimes a hoarse voice. In severe cases, children may experience difficulty breathing, which can be frightening for both the child and the parents. Most cases of croup can be managed at home with cool mist from a humidifier and keeping the child calm and comfortable. However, if your child has severe symptoms, such as stridor, a high-pitched wheezing sound, or difficulty breathing, it's important to seek medical attention. Treatment may include steroids to reduce airway inflammation. Encouraging good hand hygiene and keeping your child away from others who are sick can help prevent the spread of the viruses that cause croup. Number 9. Impetigo, the highly contagious skin infection that most commonly affects infants and children. It's caused by bacteria that enter the body through breaks in the skin, such as cuts, scrapes, insect bites, or eczema. Impetigo is easily spread from person to person through close contact or by sharing personal items like towels, toys, or clothing. There are two main types of impetigo: non-bullous impetigo and bullous impetigo. Non-bullous impetigo usually starts with small red sores that quickly rupture and form honey-colored crusts. Bullous impetigo causes larger, fluid-filled blisters that are often painless. These blisters may rupture and leave a scaly rash. Treatment typically involves topical or oral antibiotics to clear the infection. To prevent the spread, it's important to keep the infected area clean and covered, and to avoid sharing personal items with others. Frequent hand washing and keeping nails trimmed can also help prevent the spread of bacteria. Additionally, it's advisable to wash any clothing, bedding, and towels that have come into contact with the infected area in hot water. With proper treatment and precautions, impetigo usually heals without leaving scars. Number 10. Fifth disease, known for its slapped cheek rash, is caused by parvovirus B19, also known as erythema infectiosum. It is a common viral infection that primarily affects children. It's usually mild, causing a distinctive red rash on the cheeks. Fifth disease is highly contagious and spreads easily through respiratory secretions. The incubation period is typically 4 to 21 days. The first symptom is usually a low-grade fever, which may be accompanied by a headache, runny nose, and sore throat. The characteristic red rash on the cheeks usually appears a few days after the initial symptoms. The rash may spread to the arms, legs, and trunk, but it usually fades within a week or two. It's usually mild but can cause joint pain. Ensure your child rests and stays hydrated. Did you know that once the rash appears, kids are no longer contagious? It's usually more of an inconvenience than a serious illness. Most children recover fully without any complications, but it's important to keep them comfortable during the illness. Keeping the affected skin moisturized and avoiding heat or sunlight can help reduce itching and discomfort. So, there you have it. 10 common childhood illnesses that every parent should know.